Good morning and welcome to Complex Concepts of Adult Health. I'm Dr. Mike Schlegel and I'll be your instructor this term. We're going to be covering a lot of material this semester, and for good reason. MedSurg is at the heart of almost everything we do in nursing. I can't think of a single specialty that doesn't have that MedSurg base right at its core. Myself, I used to work for the Cleveland Clinic in organ transplant, focusing in liver, kidney, and one of the few places in the world that does intestinal transplants. And it really does give you a good base, and you'll see so many different aspects of the body as well as treatments and special considerations. For us in this course, we're going to be breaking the course up into your grade comprised of three exams, each worth 20% of your grade, an ATI adaptive quizzing comprised of 500 questions equaling 10% of your grade, an ATI CMS adult medical surgical exam comprising 10% of your grade, and wrapping up with a final exam comprising 20% of your grade. Starting up, getting rolling this morning, we're going to start with Chapter 3, Health History and Physical Exam. Then we'll move on to Chapter 4, Patient Teaching. Chapter 5, Chronic Illness, which is where it's going to be the bulk of our focus today. And wrapping up with Care of the LGBTQ Community. I've also got a good video in there on physical assessment, and then we'll finish the day off with a Kahoot. That Kahoot, keep in mind, it's not going to be necessarily information we covered today. This is going to be a Kahoot I created for ending a term. It has a wide breadth of med-surg knowledge. It's really going to help you see where you're sitting, where we need to focus on, and also a good wrap-up to get you started for moving forward. Anyway, my contact information's right here on the open space on the blackboard. If you have any questions, feel free to reach out anytime. You got my email. You also got my cell number. Feel free to text, set up a call. Still need a little more help. I'm also happy to jump on a video call, jump on WebEx, Zoom, Teams, whatever you prefer. And we can go through the material, make sure you're keeping up, make sure you're not missing anything. Otherwise, let's get started.